Good afternoon, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Today is Tuesday, August 30, and I am back after personally now having had and recovered from COVID. So thanks to the many of you who reached out. I appreciated your well wishes, and I'm happy to answer any questions. I, of course, stayed home for a full 5 days, and I'm now in that days 6 through 10. And so I am being very careful with masking when I am out and about. We were supposed to have some special guests today, Dr. Wilnice Jasmine from CDPH and Dr. Nicole Gastela from the Substance Use Prevention and Recovery state section to talk about International Overdose Awareness Day, but I didn't want to have anybody obviously here in close contact without masks on. So I will do a little bit of what they would have covered, and we will have them on probably later in September, which is actually Recovery Month, and it'll give us an opportunity. So let's, as always, we will go through questions. I have a number of slides that cover both some of the overdose prevention awareness month things. I also have some COVID updates as well as some monkeypox updates based on questions. And then at the end, we'll have at least a little bit of time for your own questions. You can put your questions in with the hashtag AskDrArwady on either Facebook or Twitter. So let's start with the dashboard, chi.gov/COVID-. And if we pull it up, we see from a COVID perspective, actually things are looking pretty good here. Our cases, we continue to have between 500 and 600 a day. Those are officially diagnosed cases, not including those diagnosed at home. You can see that's down a little bit from last week. Still seeing about 32 people a day on average being hospitalized with a positive COVID test in Chicago, and about 1 death a day right now. You can see our hospital beds, 4% still of all of our hospital beds remain taken up by people who have a positive COVID test here in Chicago. So that's been stable, but it is still, you know, it's certainly not nothing. You know, I was very pleased myself that the symptoms that I had a fever and I had just some cold symptoms. So didn't have any concern about being hospitalized, didn't take Paxlovid. I don't have underlying conditions. And, you know, I was feeling fine a few days later. But nevertheless, we do continue to see a lot of folks still in the hospital. And that's where I'm excited about the updated COVID vaccine that we expect to be coming, and certainly thankful for Paxlovid for those who are higher risk. So let's go ahead and move into some of the update slides here. I am going to start with just a few slides about International Overdose Awareness Day. International Overdose Awareness Day is tomorrow, and there's a lot going on there. If you use the hashtag #EndOverdose, you'll be able to see some of that. You can follow us on social media. Tomorrow, some of my team will be down with the Southside Heroin Opioid Task Force at Brighter Behavior Choices at 6506 Southwestern for a press conference. And a number of you last week were really expressing some surprise that we were talking a lot about opioids, and I thought I would just bring a little bit of data. So unfortunately, overdose fatalities in Chicago and really across the U.S. increased to record levels in 2020, and these are deaths from overdose. It's a combination of really more fentanyl in the drug supply and just ongoing illicit drug use. So you can see we had a 52% increase in overdose deaths just between 2019 and 2020, and more than 1,300 Chicagoans died of an opioid-related overdose death. That is more, as I said last week, than both homicides and traffic crash fatalities combined. And of course, we are working on all of these things, but the difference, a homicide, traffic crash fatality, of course, multifactorial, lots of things to work on. Opioid-related overdose, you can save a life if you give someone who is having an overdose naloxone, or the brand name is Narcan. This tends to be in 45 to 64-year-olds are actually those most likely to die of an opioid-related overdose death. We see overdoses in younger people, but they are more likely to be able to recover, often can tolerate a little longer, perhaps without getting good oxygen. And so our deaths, if you see the highest rates, are actually people 55 to 64, which is not always what people imagine. We see men disproportionately affected. We also see African Americans disproportionately affected. 97% of Chicago's community areas were home to at least one resident with a fatal opioid-related overdose in 2020. So this is across the entire city, and every community area had fatal and non-fatal overdoses in both 2020 and 2021. You can see on the right here, this shows the emergency medical services responses in 2021 by census tract. And you can see, particularly on the west side, that is where we see the most EMS responses. That continues to be our most concentrated area of concern for substance use and opioid use disorder. Although also on the south side, you can see that there are some areas that are getting hit exceptionally hard as well. And so that's where, for example, the newer South Side Heroin and Opioid Task Force is working. There's for a long time been a West Side focus one. Few just key messages, and please do join us on social or follow along if you want to learn more. But for International Overdose Awareness Day, we're really encouraging that you can help end overdose. You can carry Narcan, which is the brand name for naloxone. It's this safe and effective nasal spray medication that reverses an opioid overdose. It's free at 51 public libraries. You know, can you recognize an opioid overdose? We see people start to have slow and shallow breathing before they stop breathing, choking or limp body, sometimes pale, blue, or cold skin, really falling asleep or losing consciousness or having very small pupils. And if you think someone is overdosing, you got to call 911 and then use naloxone or Narcan if you have it. If somebody is not having an overdose and you give them Narcan, literally nothing will happen. So you can't hurt somebody. There's no medication that makes people, it doesn't make people sick, it doesn't make people feel high. The only thing naloxone or Narcan does is save a life by helping release opioids from the receptors in the brain. We also talked a little bit about fentanyl test strips. Fentanyl is this very strong opioid that is increasingly found in substances, not just heroin, which is another opioid, but we're finding it in pills that are made illicitly. We're finding it in cocaine. And so if people are going to potentially use drugs that they got anywhere except prescribed by a physician, we do recommend using these fentanyl test strips. And you can email us, oscu.cdph@cityofchicago.org. We're happy to send free fentanyl test strips to you. We also have them placed in locations around the city. Fentanyl was involved in 86% of our overdose deaths in Chicago in the year 2020, and 38% were only involving fentanyl. So we've distributed a lot, but there's still a lot to go, and there's more information here, and you can find more online. And then we want to be clear that another thing you can do to end overdose is to help people access treatment. We've started a 7 days a week treatment access line here. If you call the state's hotline, 833-234-6343, they'll get you connected to resources. But also for those who live in Chicago, we can get you connected immediately to a treatment provider. If you're calling after hours, we'll call you back the next day. We can help with transportation, insurance enrollment if you're eligible, and really get you the medication that can help treat opioid use disorder. The idea is to do that barrier-free, and it's available to all Chicagoans, regardless of insurance status or ability to pay. And then finally, reduce stigma. So talking about overdose is really a key part of this. We know that opioid use disorder is a medical condition. It is not a character flaw. We also know that treatment is effective. Relapse is not failure, but it is another, we sometimes see people, just like when they try to quit smoking, it can sometimes take a number of times, and getting folks into treatment is what we want folks to do. But often when there's a lot of stigma, people won't get the help that they need. And so we do encourage trying to use destigmatizing language. Don't use words like abuse or abuser or addict or clean. You know, use the word use, opioid use, or person with an opioid use disorder, person in recovery, etc. And then finally, we have a narcotics arrest diversion program that I'm really excited about. This is, to my knowledge, the largest in the country at this point, where we've worked with the Chicago Police Department. And for people who are arrested really with low level, especially possession, drug-related offenses, as long as there's not violence associated or it's not amounts that could be dealing. The idea is, instead of booking people into jail, we instead offer folks the ability to choose treatment. And since the program launched in 2018 and we've been expanding it, we've had over 900 people who have been diverted. 79% of those do start treatment, and 52% are still engaged in substance use disorder treatment at least 30 days later, which is actually very high. And those who are diverted are 44% less likely to be rearrested. So this is the kind of thing that we want to do when folks have a substance use disorder. It is first and foremost a medical condition, and we want to give people treatment. And then this is just one example of the kinds of events that are happening this week. Next Wednesday at Back of the Yards Neighborhood Council, in partnership with CDPH and others, we've got free presentations and workshops. If you want to come, 4 to 7 p.m., overdose prevention, fentanyl test building, Narcan training, art classes, etc. Information in English and Spanish. So thanks to this and the many other partners who are working on raising this week. All right, monkeypox update. Lots of questions coming about MPV. So here's where we are. We are at about 49,000 cases in 99 countries now across the world. The blue here are, of course, the countries that historically report monkeypox, and then the orange are countries that have seen this outbreak more linked to person, and especially intimate or sexual contact. The U.S. has by far the highest number of reported and diagnosed MPV cases. In terms of deaths, these are the countries that have reported it. The countries in red here that historically report monkeypox do tend to have the other strain, the Central African strain, which is a little more virulent, makes people sicker typically, but we have seen a handful of cases result in death across the world, but still very small compared to the 50,000 or so cases. In the U.S., we're at 18,101 total confirmed cases. Illinois has about 1,000 of those cases, and Chicago has 843. And if we look at the cases being reported to CDC, you do see perhaps some plateauing of case counts overall, which is good news. We talked a little bit about this last week, and we're certainly continuing to see things trend in the right direction here in Chicago. Illinois is the 5th most populous state. We have the 6th highest number of MPV cases, as would be expected, and Chicago has the 3rd, as a city, has the 3rd highest number of MPV cases. We are the 3rd largest city, so that is as would be expected. MPV is across Chicago, 65 of our 77 community areas. We've seen at least one case of MPV to date, and we continue to update this every day, Monday through Friday. You do see here that we are clearly seeing a plateau and then some decrease in new cases. I very much want to thank the LGBTQ community here in Chicago and across the U.S. We've seen, based on some surveys, there are national behavioral surveys that are done, some big changes where we've seen folks reporting fewer anonymous partners, fewer sexual partners overall right now, and a lot of folks really taking action to protect themselves and the community. So I really want to thank folks for that. And of course, we've been working to get folks vaccinated. But we are definitely seeing, last week we couldn't quite call it, but this week we are seeing a decrease in new cases, which does not mean MPV is over. It means we need to keep testing where folks have symptoms, keep vaccinating, but it is a good sign. We've had no deaths in Chicago or Illinois to date. And the outbreak is slowing. I talked a little bit about doubling time. That's how many days does it take for the number of newly confirmed cases to double. And the longer it is, the better. Our doubling time, all time for MPV, has been about 10 days, but now it's up, these last 2 weeks, it's up to about 50 days. So that continues to lengthen, which means the outbreak continues to slow at this point, which is very good news. Testing is down just a little bit. You can see we were growing in terms of how many people had been tested through the week ending the 13th. We usually do continue to see some test results come in still for the last 2 weeks of August. So we'll see where that lands. Still, the drop in cases bigger than the drop in tests, but nevertheless important to keep testing if people have symptoms. Demographics haven't really changed here. We're seeing most Chicagoans are most likely to be in that 25 to 34 age group. Also still most likely about 40% of the cases have been in white Chicagoans, 32% in Latino, and 22% in Black. 95% of Chicagoans reporting their sexual orientation who have been diagnosed with MPV have been gay or bisexual. No change there. We continue to see a good match on the geography of our MPV cases on the left and then our vaccines on the right. Good match on sex, good match on age. Continued focus on wanting to see improved both testing and vaccination among Latinx and Black Chicagoans. So we've been tracking this each week. We've seen a little bit of an improvement, but still a pretty notable gap. So on the left here in red, 40% of our cases have been in white non-Latinx Chicagoans, but on the right, 50% of our vaccines have been in that group, whereas on the left, 32% of our cases have been in Latinx Chicagoans, and on the right, 18% of vaccines have gone to Latinx Chicagoans. In purple there, 22% of cases, but then on the right, 12% of vaccines. And you see that on the right there, under vaccine, we do have more folks in that either unknown category at 6%, or another 8% are in an unothered, typically one or more race ethnicity. So it's not exactly an apples to apples comparison, but nevertheless, the one thing I would really like to see improve here are more, this match a little better, seeing more both Black and Latinx Chicagoans choose to take advantage of the MPV vaccine. We are, though, seeing an excellent match on race ethnicity for cases and Chicagoans who have received treatment. That's TPOXX for MPV. So if you look here, again, 22% of our cases have been in Black Chicagoans, 22% of our treatment courses have gone to Black Chicagoans, 40% of our cases have been in white Chicagoans, 38% of our treatment, 31, 33. So that is an excellent match. That tells me we're doing a good job of making sure folks who have more underlying conditions or are getting seriously ill are getting connected to the treatment that they need. So I want to keep that up, but I would like to see some more vaccination, particularly in Black and Latinx Chicagoans, just to make sure that everybody across Chicago is able to take advantage of the protection there. I'm not going to go into this in huge depth, but we have gotten some questions. So I did want to talk intradermal injection, just as a reminder. The FDA authorized giving what's called an intradermal, meaning instead of going deep into the subcutaneous tissue, you give a very shallow injection, as you can see on the right there. And it can create this little, what's called a bleb, a little fluid pocket. We usually give this on the forearm, but for those who don't want to get a vaccine on the forearm, you can also give it behind the shoulder blade. And it's a similar technique to those who have had a tuberculosis test. That lets vaccinators give up to 5 vaccinations, typically 4, out of one vial rather than one, and it's really increased the reach of our vaccine. And so as of really last week and even the week before, we'd seen more than 3/4 of our vaccination sites switch over to this mode of administration, and intradermal is appropriate for second doses, even if the first dose is administered subcutaneously. So in case you missed it, eligibility for monkeypox vaccine has expanded in Chicago to all sexually active gay, bisexual, and other men who have sex with men. Let me say that again. Any gay, bisexual, or other men who have sex with men can get an MPV vaccine. and all sexually active transgender persons can get an MPV vaccine. So initially we were having to limit it to people with other risk factors, but now, especially with the intradermal administration, we have plenty of vaccine. So we've opened that up widely, and we want to give second doses. So we are no longer holding back on giving people their second dose. To be considered fully vaccinated against MPV, you need to have 2 doses, at least 28 days apart. So if it's been 28 days since you got your first dose, you should go ahead and get your second. We have plenty of appointments available at chicago.gov/MPV. There's more information here. We continue to vaccinate anybody who's a close contact, household members, etc. And we continue to vaccinate 6 days a week at CDPH's 3 specialty clinics, one in Lakeview, one in Austin, one in Roseland. So you can register there. We have appointments this week, first dose, second dose, come get the vaccine. And then this is really likely to be the last weekend for a little while that we'll have significant numbers of vaccine available at city colleges for MPV, and that's because the updated COVID vaccine will be coming. And so this weekend is the weekend to do this. Truman College on Saturday from 9 to 2, and then Malcolm X College on Saturday from 9 to 2. Please visit the MPV vaccine, sign up. We would love to get a lot of folks vaccinated this weekend, because we're going to need to, we'll continue doing MPV vaccine, but we're going to need to turn especially some of these larger clinics to help meet presumed demand for the updated COVID vaccine. So this week and weekend would be an excellent time to get your MPV vaccine. And we've got clinical providers across the city that is also available online. Continue to do mobile LGBTQ focused events thanks to so many partners. Nothing has changed in terms of what we've seen for risk. The highest risk continues to clearly be sexual or intimate contact, even when wearing condoms. Condoms are not totally protective against MPV because direct contact with the infection, rash, scabs, or body fluid is also high risk. So nothing's changed here. We've not seen a huge spike after market days. We've not seen major spread in unusual ways. So continuing to certainly watch this closely and work on it, but I feel quite good about how our MPV response is going right now. So as always, if you have any questions, visit the website or give us a call. I do have some COVID slides, and then we'll get into your questions. So the biggest news is that we are getting close to the updated COVID vaccine. And I want to make sure people have some understanding of this. So last week, Pfizer and BioNTech announced that they had asked to authorize an updated version of the COVID vaccine. Moderna has now also submitted. And the idea is this updated vaccine is bivalent, meaning it's a mix of 2 versions of the vaccine. It's both a boost of protection against the original coronavirus strain, so it's like getting the kind of booster that you've had all along, but new, and for the first time, there also will be protection against the BA4 and BA5 Omicron subvariants. So if the vaccine is authorized by the FDA and approved by the CDC, some of which may happen this week, vaccination could potentially begin as soon as the week after Labor Day. So that's as soon as potentially next week. Who is expected to be eligible to receive this updated COVID vaccine? This is all pending FDA and CDC this week, but what we're hearing is it's likely to be anybody age 12 plus who has completed their primary series. So that would be about 1.8 million Chicagoans, or about 77% of our age 12 plus population. We are expecting to be eligible for the updated vaccine. Here are just a few, we've been getting lots of questions, preliminary questions and answers. I want to highlight these could change again as the FDA and the CDC give their authorization and approval. But again, who can get the updated booster? Anybody likely age 12 and up who have completed a primary series, meaning 2 doses of Pfizer or Moderna or 1 of J&J. If you didn't get a primary series, we are more than happy to start your primary series right now and then be able to get you that updated booster down the line. But you do need to have the primary series first is our expectation. Does it matter whether I got a booster in the past? No. We are waiting on for FDA and CDC. They will weigh in on exact time frames, so I don't have answers for that just yet. But the bottom line is, even if you didn't get a booster in the past, we are expecting that you will be able to get this booster. Are there age limits? We're expecting the Pfizer booster to be for age 12 plus, and we're expecting the Moderna to be for age 18 plus. There may be an updated booster for younger children in the future, but we are not anticipating an updated vaccine for younger kids at this time. Will it still be free? We're getting that a lot. Yes, thankfully. The federal government is providing the vaccine. CDPH has not received any additional money for the rollout, but we are, tying it to our flu campaign where we can, and working with partners, et cetera. But rest assured, this vaccine, the updated vaccine, will remain free to you. When will it ship? So I don't know yet. The CDC is planning to roll them both out at the same time, assuming that they get approval at the same time, and it'll definitely be after Labor Day. There's 2 things we need. We need emergency use authorization from the FDA, which we are expecting to probably happen this week. That has to happen before any shipping can even start. And then we need the ACIP, which is the Advisory Committee on Immunization Practices that advises the CDC. They need to give approval, and the CDC needs to give approval to actually start administering. That's the details of how long after the last vaccine and all the details really come from CDC. So the ACIP meeting is set for this Thursday and Friday, September 1 and 2. So if that green light comes and then the CDC gives it the go-ahead, we may have approval by the end of the week. And so we could be getting the first doses possibly as soon as next Tuesday. So we've been planning and preparing for that. Rest assured, we are ready to go and excited. And the reason I'm excited is that everything we are seeing is Omicron, and it's BA4, BA5. So if you look, the dark green here is BA5, and that's more than 90% of our cases. This is across the Midwest, but it's true in Chicago. And then pretty much everything that isn't BA5 is BA4. So you can see about 6% of the cases have been BA4.6, and about 4% have been BA4. And look at this, just 0.3% are anything except BA4, BA5 right now. So 99.7% are exactly the kind of variant that this vaccine is made to protect against. So I'm kind of sad that I got a souvenir from my vacation, which was COVID, because certainly that was BA4 or BA5, and literally I was about 2 weeks away from probably being able to get the protection. But the timing is really good here, and I strongly, strongly encourage folks to go ahead and get this vaccine when you're able to, because it's a really good match. Couldn't ask for a better match. And if we can get a lot of folks updated, that should help with breakthroughs, and it should help us really be in a good spot heading into the fall and winter. Across the U.S., it's the same. Everything is BA4-5. Look at that, 99.8% of the variants across the whole U.S. are Omicron, BA4, 4.6, or 5. We are, of course, at more than 1 million deaths across the U.S. And still seeing hospitalization. Chicago remains below both the national and state average for cases, and we remain at a medium level here in Chicago and across the Northeast. And these are the numbers, in case you're curious, for both Chicago and Cook County, staying at a medium level. And I remain concerned, and I just want to highlight that even with the updated vaccine coming for those 12 and up, really want to see the younger ones getting vaccinated. We're still at only about 11% of the 0 to 4-year-olds, and we are seeing some kids get hospitalized for COVID. And almost always, those are kids who are unvaccinated. Often they have other underlying conditions, but not always. So please, with school coming back, take advantage of the opportunity to get your kids vaccinated. Just quickly, isolation versus quarantine. Isolation, like I had to isolate. I had to stay home for a minimum of 5 days, and then I can return to school and work, but I will mask through day 10. And then quarantine is those who have been exposed but don't have symptoms. We want you to monitor for symptoms. We want you to mask for 10 days, regardless of symptoms. We want you to make sure, take a test at least 5 days after your last exposure. So nothing has changed here, but let us know if you have questions. Regardless of your community COVID level, you need to mask if you have potential symptoms of COVID, if you have a positive test, or if you're exposed to someone with COVID. This Saturday and Sunday, in addition to MPV vaccines, we're also offering adult and pediatric COVID vaccines and boosters. Not the updated vaccine, to be clear. It's not available yet, but especially for kids. This is our last round to get the little ones up to date. So we'll be at Truman and Malcolm X. And our at-home program continues strong. We will be rolling the updated vaccine into our at-home program once it's available. More to come there. But in the meantime, now is a great time to get your COVID vaccines, any age, and do that ahead of the booster if you haven't gotten your first or second shot. Those are our numbers, and that was a lot. So let's get into your questions. All right, so, oh, thank you. I've got some nice comments from folks. Rico MJ Hampton on Facebook, for example, says, glad that you're feeling better. I'm very glad too. It was not fun, you know. It was nice to know that I didn't have to worry about severe illness, but still, you know, I had fever for a couple of days. Someone is asking about just some stuff about testing and where are we. So I'll tell you a little bit more about my testing history if you're interested. So because I was back from vacation, I actually was taking a COVID test, which had been negative, but then I started getting some symptoms, actually last Tuesday evening. And although I had a negative COVID test, to be honest, right from the beginning, I just was like, ooh, I think this might be COVID. I was a little bit achy. I just felt, you know, I kind of know what a viral infection feels like. And so I stayed home that Wednesday. And then when I tested later that Wednesday, my test was positive that night. And so, you know, to the point, some of you have been asking, occasionally, I'm not feeling well, but I'm having a negative test. And this is where we want you to stay home. We want you to mask, you know, if you think it's COVID, even if you're waiting for a positive test. Because in my case, it took almost 24 hours for that test to turn positive. But I had stayed home and worked from home the first day, just to be careful. And that very first rule hasn't changed, right? The stay home if you're sick. Okay. So a number of questions about the new COVID vaccine. Kim Joyce Garati from Facebook. Can you get your flu shot at the same time as the updated booster? Yes, we fully expect that you will be able to do that. And in fact, we will likely, one of the reasons we're planning at some of the larger clinics to offer both the flu vaccine and the updated COVID vaccine is that we anticipate a lot of people will probably want to get this together. So again, I always have to put a little caveat because we'll need the CDC and FDA to give that the official green light, but I absolutely expect that will be the case. Mary Rodriguez from Facebook says, glad you're feeling well. For the updated vaccine, is mix and match recommended? Should people accept which one is available or try to stick with the same vaccine maker? Are Pfizer and Moderna similar in dosage content? Yeah, good question, Mary. So again, we'll get some official guidance on that from when we get the final FDA and CDC. But I would say that people should, my expectation is that they will recommend and that people should accept whichever one is available. Obviously, the Pfizer is going to be for those 12 and up, and the Moderna for those 18 and up, but they are roughly similar in terms of dosage and content. We'll share a little more details of that once the FDA and CDC have met, so there will be a lot next week. But I think it's fine, honestly, to get either of them at this point. And I do think we're getting some preliminary information. For example, how much vaccine we'll be receiving in Chicago. It looks like, and I know that the federal government has purchased more more Pfizer boosters than Moderna. And so it may be a little easier to find Pfizer. That said, we know Pfizer was first. We know Pfizer is the one that especially the 12 to 17-year-olds can get. So it may be a little easier to find a Pfizer vaccine than a Moderna vaccine, but I would just honestly encourage you to get whichever one is available. Okay. Alexandria Deanne on Facebook. I saw a report that the new COVID booster shots for fall hadn't been tested on humans. Is that correct, and how concerning is that? Yeah, thanks for that question, Alexandria. So let me kind of highlight exactly the testing and where we are. So there was a full round of human COVID vaccine testing with an updated COVID vaccine that covered the earlier versions of Omicron. So it covered BA, 1 and 2, and I think up to 4, but certainly 1 and 2. And there was the full regular human trial with this bivalent, and that went great. No concerns from a safety perspective. It was good and protective against those earlier Omicron strains. And actually, the UK went ahead and gave the green light to a version that had BA4 in it, but not BA5. There was a decision here in the US, which I fully endorse, especially seeing where we are now, to instead say, let's get BA5 in there too, given that we were seeing BA5 emerge. And now, like I showed you, more than 90% of the cases are BA5. And so with the BA5, there was not an additional human study that was done with that BA5 because there's not time to do another whole human study, but there's no difference in terms of the approach or the change from what was done with the other BA1, 2, 4, which did have human studies. There were what are called preclinical studies that were done, meaning in some of the animals and some of the cells, et cetera. This is actually how we do updated flu vaccines every year, so it's nothing different from that. So what I would say is that this exact updated vaccine did not have the full scope of like the extended human trial like an earlier one would have, but that's not a concern from a safety or efficacy standpoint because it was done with the earlier versions and using the same technology, but the decision was made to get BA5 in there as well. So there will certainly be all of the monitoring, and I'm actually really interested to see the efficacy of this for BA4 and 5 in particular. I expect it'll be good, and there are, if you look at all of the advisory groups, the experts, there's not any safety concerns related to the release of this. It's more a question of the efficacy. And I think it's really good that the timing of this is working out. So I'm not at all concerned about the way that the testing has been done. And I would encourage you to take a look, if you're interested, and read some of the studies from the version that was made initially, and then the same technology is being used. Okay, Amanda DW from Facebook. Glad you are feeling better. Do you think I got it? Do you think you got it on the plane? So I don't think I got it on the plane because planes are actually one of the places that have good air handling, and there's masking, et cetera. I will say, I was traveling with a lot of extended family members on my vacation, and we had a lovely time, but we were I was masking less than I normally would because I was with family, et cetera, on vacation. And I was not the only extended family member to get COVID. And so I don't think that it was a plane thing specifically. I think it was more likely just a lot of us gathering with family, as can happen. And I do know that it happened on vacation because of the timing, but I think it is less likely that it happened on the plane per se. And, just like always, like 90% of the time where where we see, it's a little bit of letting down. I let down my guard a little bit when I'm on vacation and with my extended family. It was not the vacation souvenir I wanted, but I'm still very glad that I went on vacation. And again, everybody's doing fine, and everybody, of course, is fully vaccinated and up to date. I wish we had already had the updated COVID vaccine, because if all of us had been able to be up to date there with that extra protection against, BA4 and BA5, I think the chances of me getting it would have been quite a bit less. But what are you going to do? At least now I can answer questions from a first-hand perspective. So thanks for the question. Okay, let's take a couple of MPV questions. Chad Horn on Twitter says, a friend got his first MPV vax dose in the muscle, it was probably subcutaneous, but the deeper one, and his second dose intradermally. When he got his second dose, his provider said he'd need a third dose, 2 total intradermal doses to be fully vaccinated. Is this true? Or can you mix and match vax delivery? So this is not true, Chad. Thank you for that. Any provider, we've been doing a lot of provider education, but we'll do some more. And if there are questions about this, send people to the CDPH website, which answers this very specifically. You absolutely can mix and match vax delivery. So if you got your first vaccine with the regular vaccine, you can, FDA has said very clearly, you can get that second dose intradermally, and you don't then need to go and get a third dose. You just should get that second dose, though, at least 28 days later. And I'd say the difference is that, again, usually we give it in the forearm, and it can create what's called a little bleb. That won't be permanent, but it will. It's just a different way of administering. That shallow administration gives more of an immune response typically, and so you are able to get a vaccine, for example, behind your shoulder blade, if for some reason you don't want to get the vaccine on the forearm. But that's a really good question. Walter D. McCoy from Facebook, where can I go to get the monkeypox shot? So I shared a lot of information. If you go to chicago.gov/monkeypox or chicago.gov/MPV, or give us a call at 312-746-4835, we will figure out whatever is the easiest for you. We are operating free vaccine clinics 6 days a week in Austin, in Lakeview, and in Roseland. This Saturday, we have large MPV vaccine clinics, free, available at Truman College and Malcolm X. And then we have literally dozens of partners across the city, if none of those are convenient to you, who are happy to help get you vaccinated. So please give us a call or reach out. No, you do not need to be a Chicago resident. Of course, our top priority is getting Chicago residents vaccinated, but if you live anywhere in Illinois, you are welcome, and we would like to see you get vaccinated. Okay. Mary Kay on Facebook, where can I get Novavex? So Novavex, for those who don't know, is a more recently approved COVID vaccine at the federal level. If you go to vaccines.gov, you can put in Novavax, and it will help you find vaccine appointments. You just select Novavax and you put in your zip code. There are less options across the city than there are for Pfizer and Moderna, but there are many locations in Chicago that have Novavax. So go to vaccines.gov, put in your address, and that's where you can find. Novavax does not have an updated booster, an updated vaccine coming anytime soon. So this would be for your primary doses, just to be clear. Okay. All right. Let's see, how are we doing on time? We're getting up close here. Let me see if I can get some more of these in real quick. Lisa Baldevinari on Facebook. Have you heard of something called Paxlovid mouth? What is it and how do you get rid of it? So Paxlovid mouth is a term for when people take Paxlovid, which is the most common oral medication for people who are at higher risk for getting severe COVID if they get diagnosed. This is the medication we want want you to take, but you've got to take it in the first 5 days of symptoms, and it can help cut the risk of getting hospitalized or dying. Paxlovid mouth is the terminology that not most people, but some people can get a metallic or metallic bitter taste in their mouth when they take the medication. In the study, and this had full studies, about 5 or 6%, 1 in 20 people who were taking Paxlovid had that taste in their mouth. And it goes away when you finish your course of Paxlovid. So you usually take it for a few days, and then it goes away. It's not long lasting. It's not dangerous, but it can be unpleasant for some people. And so there's a number of tips that if folks are taking Paxlovid, try taking it with some gum or with some mint. Some people also take zinc. They think that can sometimes help with Paxlovid mouth, quote unquote. But it's not dangerous. It's not like losing your smell and taste. It's not related to that. We think it probably has something to do with just how COVID generally can interact with some of those nerves. We've learned a lot about kind of smell and taste, but no, it's just a short-term side effect that about 1 in 20 people who take Paxlovid can have. It is not a reason not to take Paxlovid, okay? If you are somebody who is recommended to take Paxlovid, take Paxlovid. I didn't take Paxlovid because I didn't have any symptoms, from here down. It was basically just cold and fever, and I don't have underlying conditions. But when my parents, for example, have ever been diagnosed with COVID, I made sure they got Paxlovid right away, and I would strongly recommend. You can get Paxlovid whether or not you are vaccinated, and it's especially important for anybody who's not up to date with vaccine because it can really help keep people out of the hospital. Lisa Weinhold on Facebook says, very faint line on home test, PCR negative. Am I safe to be around my immune compromised mother? Will continue to home test and mask. So I'm presuming this is you recovering from COVID, Lisa. If you're recovering from COVID, there's differences in terms of, as the timing of when you can get this, et cetera. I don't know kind of your whole situation. I encourage people, if you're just getting over COVID, I would certainly be careful around anybody who is immune compromised. I think, if you are going to see your immune compromised mother and you're still just at the end of testing positive there, for example, I would recommend meeting outside. I would recommend both of you wearing masks. You just want to be a little bit extra careful. Yeah, so I hope that helps. And usually when you see a faint line, it'll go negative a little bit after that. But it's people who are immune compromised, that's who we want to be the most careful around. All right, and then we'll just end here. A couple of questions about schools. So Janice's Magic Wand from Twitter says, at what point will masks be required in schools? From August 18th to August 24th, there were more than 2,000 people that died of COVID nationally. It seems like more than just a little cold. It definitely is more than just a little cold. The great majority of people dying of COVID, of course, thankfully, are older and have underlying conditions. But it is not just a little cold. It is not just the flu. And there are times when masks are required in schools, to be clear about this. If somebody has been diagnosed with COVID, and they're back in days 6 through 10, they must mask. If someone has been exposed to COVID, there's been a case in a classroom or in a cohort, the other people in that classroom or cohort need to mask for 10 days. If there's been a major outbreak, there are other settings where you may need to mask. So masks are definitely not gone from the school setting, but they're used more when there are cases or increased risk. And so, I kind of think of masks like I think of umbrellas. Like you want to have them on hand. There are times that you are going to need to wear one, and there are times that you will choose to have one on. I certainly like to see folks masks. I'm the most concerned if people are not vaccinated. So I hope that helps answer the question. We would I would not anticipate a setting where the Chicago Department of Public Health would require masking in schools at a time that we did not require masking more broadly, sort of in the community at large, given that there are many settings that are higher risk than schools. If we were to see, for example, a variant of high consequence, meaning a variant where the COVID vaccine wasn't working, the tests weren't working, people were getting seriously ill. If we were to see a major surge where the healthcare system was getting threatened, for example, and we needed to be putting mask requirements back in place at the city level, that would, of course, apply to schools too. I hope that that's something that we never have to do again, but it's something that we are ready to do if the need should arise. But otherwise, just like we do in all other settings, we use masks when there are outbreaks, cases, and they're something that they're not going to go away forever. They're going to be something that we use to help continue to limit risk. And then Dr. Shaw on Twitter put in a note here about the CPS COVID dashboard saying, what are you going to do about this? Because CPS has reported 519 cases in adults and 828 cases in students. I want to be super clear that that is in no way an unexpected number. If you look at what our numbers have been like at the this is before there's been routine testing happening. This is what we're seeing. And anybody who imagines that COVID is gone, it is very much not gone. So, we've been working closely with CPS, of course. They have good protocols in place. Wherever somebody is testing positive, they must stay home for 5 days, regardless of whether they're vaccinated. If they're feeling better, they can be back days 6 through 10 with a mask. When there's a case in a classroom, in a cohort, there's notification that happens, and then there's distribution of testing. CPS is going above what is required in terms of offering tests. The idea is really twice in that week that follows, offering home tests so folks can take them home to make sure that that's easy and folks are, can access that. And then where there have been cases, people are also required to mask. So that is what CPS is doing, and I refer you to CPS if you have additional questions, but there is nothing about those case numbers that are at all surprising to me. Remember that in CPS is the size of a not very small town, so having hundreds of cases is what you expect in a town that size, and those numbers will continue to go up, and you should not be surprised by that at all. And that's why, of course, they encourage masking, and then we require it in certain settings. Okay. So I think the last question I'll take here is Francie Swidler on Facebook says, I know of some people who recently got shingles and are below the age to get vaccinated. Is there something going around? Should I be taking precautions? So just as a reminder, for those who may not know, shingles is a reactivation of chickenpox. So if you had chickenpox as a child, you can have a reactivation of that chickenpox virus decades later. And that reactivation is more likely to happen as you get older. It's also somewhat more likely to happen if you are immunocompromised or sometimes if there's significant stress. So there has not been a change in terms of the recommendations for who should get the shingles vaccine. ACIP, the same group that weighs in on COVID vaccines, sets those recommendations. And so go ahead and check there if you're curious, but there's not been a change. And you should ask your doctor if you are not sure if you are eligible for the shingles vaccine. If you are eligible for the shingles vaccine, please get the shingles vaccine. You do not want shingles. I've taken care of a lot of people with shingles. It's painful. What happens is the virus emerges actually in the distribution of a nerve, and so it's very painful, and it's unusual. There's really nothing else that looks like it. One of the reasons we now vaccinate kids against chickenpox is because if they're vaccinated against chickenpox, they never get chickenpox in a long-term kind of way that will also help protect them from shingles. So, this is something that those of us who all had chickenpox as a kid, I had chickenpox as a kid, need to worry about. about that hopefully in a long-term way, it'll be something that vaccines make less and less likely to happen. But no, there's nothing particularly unusual going on that I've seen or been aware of. Check with your doctor if you have additional questions. So thanks for that. And then just a few more thanks for some more kind well wishes. Chris Wilder from Facebook says, I turned in late, heard your voice and thought, oh no, it got you. So glad to hear you're feeling better. And I am. Thank you, Chris. And then Terry Dodd just says, glad you're feeling well, Dr. Arity. So yeah, I'm glad to be feeling well too. Can I tell you how good it was? I was not happy to have COVID, but to know that I didn't have to worry that I was going to get seriously ill, to know that, you know, if I wasn't feeling better by day 3, I could get Paxlovid, you know, to really help decrease that risk. I didn't end up needing to because I was feeling better, but it's, you know, it's no joke. I had some fever. I was really not feeling great for a couple of days there. And thankfully it you know, was able to put it behind me. But I'm being very careful. You know, I'm masking. And I will be masking, you know, for a total of 10 days. And that's exactly what I want to encourage all of you to do. It means that there's some things that I would have been doing this week, you know, going to dinner, et cetera, that I'm not doing. And I really want to be careful. I don't want to further spread COVID, but I do want to just use the opportunity to say that in about 2 weeks, when the updated COVID vaccine is here, the chances that I got COVID on vacation would have been probably a fair bit later if I had gone just a month or so later. And for all of you too, I do think the chances of protecting yourself against not just COVID, but Omicron BA4 and BA5 are going to be a lot better with this updated COVID vaccine. So I'm really excited about it. It has the potential to be a big deal. And even though I myself have gotten a little bit of a COVID BA4, BA5 lesson myself, certainly I will be getting that updated vaccine whenever it's recommended from CDC and FDA. So more to come for sure next week. If you're interested in the conversation, on Thursday and Friday, you can stream the ACIP. It's a 2-day meeting, and they talk in great detail about everything that has to do with COVID vaccine. And it's one of the best ways to kind of see some of the science and follow along. So we will certainly bring you more. I think if the vaccine is authorized by the end of this week, we may do a stand-up instead of Facebook next week, but more to come. In any case, you'll be hearing from us quite a bit next week once we know for sure, and we have final answers to your additional questions. But I'm really excited about that updated vaccine. And yes, I am glad to be feeling much better and really appreciate everybody's questions and attention, and have a really good week. Thanks, everybody.